Hello, and welcome to the healow podcast, brought to you by the ECW podcast. This is a series in which we spoke with patients, doctors, nurses, and the front office staff at Grove Medical Associates in Auburn, Massachusetts, and chronicled their progress. Our host for this series is Amber Asaro, and welcome to episode 4, The Progress.
After following the patients and staff of Grove Medical Associates in the Home Health Monitoring Project for 3 months, it's finally time to hear how things turned out. Back in June, Jack was the first patient to sit down and talk with me. You'll remember his enthusiasm and determination. Here's what he had to say when we talked again in September.
What I wanted to accomplish, obviously, was more walking, but like I said, work is kind of, long hours, an hour plus commute each way, and at the end of the day I just don't feel like doing much of anything. But this is a reminder that I do need to walk. So if I go to the bathroom, I do take the long way around and stop and visit people, and they all recognize that, oh, you're out for your walk today. Like, yeah. So with that, it's good.
So why is making a change for better health such a challenge? Most of us have at least a basic understanding of what we need to do to be healthy. Physician visits are a time for a reminder on where we should make improvements.
I think right after the doctor's visit, I would be like, you know what, okay, give me a month of adjusting, I'll try to get myself psyched up. And it never happened. It'd be next week, next month, next week. It just, the thought was always there, but there was never a point where I decided, okay, now's the time. There might be a week or two where all of a sudden, I was eating more salads or something like that, but never all the way, the commitment.
Dr. Steinhubel at the Scripps Translational Science Institute explains,
I think that compliance is always going to be an issue. Health is kind of an interesting area, and some of our patients are very hypervigilant, but many others are, if I feel fine, I'm not going to worry about it. And so that's one of our biggest hurdles that we need to understand is how do we incentivize the individual patient to really want to take better care of themselves. And I don't know how we can do that, but I know that the home monitoring at least allows us to start asking the question.
So lesson 1, handing patients devices won't automatically lead to change. There's something more. Here's Ray, a medical assistant at Grove Medical, who you'll remember from our last episode.
People who have the initiative, who have, the willpower to do it, but just didn't quite know where to begin. They didn't know how to start, who to turn to. And so when we started this, we had all these patients who, were ready to take back their lives. We actually had patients say that to us. It's my turn, it's our turn, time to take back what we need to do. So it was just a really amazing opportunity for us to kind of step in and say, well, you have the right attitude, so here are the tools.
You'll recall from previous episodes that, like Jack, William also had concerns about his demanding schedule and remembering to maintain his health routine. Here's how he did.
Do you remember what you set out to accomplish at the beginning of this project, and how do you think you did?
Oh, goodness. I know I wanted to improve. Do you know what I wanted to do? To be honest with you, I can't recall how I
think you wanted to improve your activity and your blood pressure.
Yeah, and I did.
By now, we've already heard many patients and staff refer to Michaela, the nurse practitioner at Grove Medical. Since she meets with patients regularly to examine changes they can make to improve their health, I asked her for insight into why this real-time data might be helpful to some patients.
I think that you come from a psychology background, and I really wanted to ask someone some perspective, I guess, on behavioral change. How do you think that home health monitoring will help a person, or do you think so?
I think it definitely helps. It gives people a visual cue to realize that things that they may be doing in their life aren't either working or they aren't working. And I think people, to make a behavioral change, people need to actually see things. So if they're seeing that their blood pressure is high, or they're seeing that their blood sugars are running high, actually seeing the numbers might make things click for them so they can make these changes that they need to do.
William explained this in one of the group meetings he attended with us every month.
Oh, it's funny when you start to link. Okay, so I did this many steps. Now let's say I'm going to change this with you just sort of start realizing the things that you were doing wrong, and then if you just add up, like eating this instead of that, and getting the extra protein, you feel all the much more better, and the results are even better, and then you just try to keep finding other little things to add throughout the day, and in the end it does. It makes a big difference after a week, after a month, and then you see the changes.
However, Jack had mentioned this benefit himself.
It makes you cognizant of what you're doing and how it will affect your numbers. So instead of having something that you really shouldn't have, I mean, sure you can have it once in a while, but at least you'll be aware that how it's going to affect your body and your numbers.
But Jack still didn't feel like he had succeeded. What else could have made the difference?
The monthly meetings help?
Travel. I was at the first one, and I was at this one. I couldn't attend the other ones.
So there's a difference. William met with the practice and other patients every month, while Jack only made the first and final meetings. Now, initially these meetings were just intended to check in on progress and offer any technical help patients needed for their home health monitoring devices or the app. But based on questions coming from the participants, Grove Medical started to offer bite-sized pieces of information at each meeting.
I think having the meetings are good too. They can meet with other people who are having the same issues. I love that Elise was coming to the meetings and giving recipes and teaching about portion control, and I think people don't realize what one serving size is. But that's not billable, right? I think you can do it. You can find ways to do it. We found ways to do it. We've been doing it after hours, and everybody has been coming. So people, I really think, I've been meeting with Marianne, and she comes to the meetings, and she meets with me on probably about a monthly basis, and she looks forward to going to the meetings because there she's meeting with other people who are using the same equipment. They're troubleshooting problems that they might be having with the equipment, or, finding that they're plateauing on their diet, or, whatever it might be. But there's other people there that are experiencing the same thing.
Jessica agreed.
I just think it was a great program. I think having other people that have the same issues and are using the same things to talk to, even if it is only every 6 months or every few months, it makes a big difference. I just learned things standing out in the hallway waiting to come in here.
The day after our final interview, we received an email from Jack. Part of it reads, "I also wanted to thank you for organizing the monthly meetings. There's great benefit to those meetings in that it provides an open forum for people to share their successes and their problems. In hearing some of the success stories last night, my motivation was reinvigorated to get more steps in each day, as well as strive for better meal choices." He added that the staff at Grove Medical had mentioned getting together on a regular basis even after this project ended, and he thinks that's a great idea. The nutritionist, Elise, was present at each of these monthly check-ins with patients.
A mind educated is forever changed. Mm-hmm. And I say that to my students and my patients. Now you know better. And really, can you go back to the way you were eating before? Mm-hmm. And a lot of them are like, no, I can't, because now I know how bad that is for me. So education's the key. Where do you get that education is then the question.
The answer to her question seems obvious. We know that part of a doctor's responsibility is to help their patients understand how to manage their health. But it turned out that in these meetings, as patients got to know each other, they wanted to share what worked for them and encouraged each other. In this clip, you'll hear some familiar voices in our final meeting in September, including Elise and Dr. Weinstock of Grove Medical, as well as patients Mark, William, and Jim.
I actually thought it was interesting that I was looking at just overall fitness, and then by having the activity monitor on there, I was starting to basically look at how that kind of correlated to my blood pressure and my nutrition, as we were talking about, and it really changed a lot of what, how I, kind of went from, X amount of weight to, I wasn't even looking for weight loss, and I lost weight, and I'm feeling better, and it was kind of like, I needed like this little gadget just to remind me to be fit.
And about healthy eating, people ask me, well, what kind of special diet do you want? I said, just, no more Chinese food, which I love.
Dr. Kelly does.
No fast food. I go by that now. There's always protein, there's always chicken, there's something in the refrigerator at home. So it's just really eliminating salt, French fries, fast food, Chinese food, anything with salt. Everything 10 pounds just kind of came off by itself because I really haven't got my exercise back up to where I want it. I'm getting there, but I'm a little nervous about it. So just getting rid of the salt, I lost about 9 pounds. I haven't got to the 10 pounds yet, so just healthy eating.
Well, yeah, that's what I was looking at is with the blood pressure.
Yeah.
It started off pretty high, and I really reduced that down. But in the effect of just redoing that, I lost weight.
I try to explain, get up there 3-4 days a week. It's hard to get motivated, but when you see the benefit, that's what maintains it. And then patients, they come in, they feel better, they realize they feel better. So it's a positive reinforcement you have on yourself that really helps you kind of continue it. And when you kind of fall off the wagon, you realize, well, geez, wow, I really do feel bad. I felt much better when I was exercising regularly. And the weight will fluctuate, but the benefits of just that cardiovascular piece is huge. So.
Yeah, it's amazing on how you don't want to sabotage yourself. Like you're working so hard to look at the numbers and all that stuff, and then you start realizing, I can't do that. I'm going to set myself up, and then I'm going to fail.
It's funny with the
you don't want to sabotage.
People who do the best with weight maintenance are chronic exercisers. And it's the mindset. Why would I want to go eat a hot fudge sundae? I just went to the gym, or I just worked out, or whatever. And with my patients, we never use the word diet. The American Dietetic Association is now the Academy of Nutrition and Dietetics. They've even gotten, all of their materials don't have the word diet. Because we work on permanent lifestyle changes. What can you do and maintain for the rest of your life? That it just becomes habit, it just becomes how I eat now. That I always have a source of protein at breakfast, maybe something high fiber. I feel better. And then you notice when you don't eat it, you're like, ugh, I feel terrible. Why would I not go back to feeling good?
Well, I'm still having lobster. I don't care what.
These monthly meetings were a great opportunity for Elise and Dr. Weinstock to speak to patients about 1 or 2 things they could do to improve their health. Like at one meeting, Elise focused on sodium, and at another, Dr. Weinstock educated them on good sleep hygiene. Dr. McDowell, the nephrologist in St. Augustine, Florida, comments on the importance of this.
I think, as we gain more medical knowledge, it's important to know how to summarize the important things you want to get across to patients. You don't want to overwhelm them with too much information, but there are some very important points that you do want to get across. So if technology and education can help patients understand the important points of what we're doing medically for them in a way they can understand and relate to, then I think it can make a big difference.
So patients working on similar issues can help each other, but they also need some help from the medical practice. You don't want to overwhelm patients with too much information, or it can be hard for them to retain everything. Which leads us to lesson 2. Home health monitoring gives patients new data, so they need to know what to do with it. I was talking to Marianne on the phone.
And I don't know how to read my blood pressure. I know when I've been taking my blood pressure, I noticed, I think it's up in the left-hand corner, or it's in the left hand somewhere. Like, usually it's a green light or a yellow, like a little color that's on there. Uh-huh. Did you notice that?
So I asked Dr. McDowell.
Do you think that your patients typically know what normal is for them?
I don't think they know, per se, exactly. They know the classic one. A lot of them know 120 over 80, but a lot of them may not know about, for example, pre-hypertension. When I see them in the office, I'll give them a goal. So they have to be educated. My concern would be if we're not getting accurate numbers, if we're getting blood pressures that are not accurate, or weights. Not every scale works well. And if they're getting numbers that are inaccurate, then I could potentially change my therapeutic approach, and that would be my concern. So I would want to make sure that these are reliable devices and that are well calibrated and are giving me accurate numbers.
So if I were a patient that went and bought some equipment, what would be
what should I do to make sure of that, really? That they are calibrated?
Bring it into the office. You know, I tell my patients, bring in your blood pressure cuff to the office and we'll compare it to a manual reading. That's one thing I can do.
This came up when I spoke to Jim back in July.
Right now it's saying, I have hypertension 160/105. My 30-day average being 168/105. So should I rush into the hospital and have them check it out?
Yeah, I would call them, Jim, and I would, especially before leaving the country, I would just give them a call and ask them what they want to do. I would take in the cuff that I'm using at home and make sure that they are working the same way, and that way you can really trust your readings at home. Yeah. That is high.
Sometimes patients don't know or don't retain an understanding of what the numbers from their devices mean to them. In order to make changes that improve their health, they need to be reminded of how to respond to this new information they're getting from their home health monitoring. They also need to know when to recheck the readings and when to call their doctor. Dr. Steinhubel cautions,
you just can't give somebody a home blood pressure monitor and say, okay, come back and see me in 3 months and bring all your home blood pressure results with you. That has been shown actually to be of no benefit. But if you develop a system where you give that person feedback on whatever they're monitoring at home, then that has been shown to make a difference. And we know that one of the stronger reinforcements to compliance is having a physician talk to the patient about what's going on and why it's important for them.
This last element that Dr. Steinhubel brought up came up when Barb and Jim sat with me to review their progress.
Just knowing that your doctor and your nursing or your medical staff can see where you're at is going to be helpful for you as a person. Plus, you're not just keeping anything inside. They might see something that you don't see or you wouldn't realize.
Do you guys remember what you wanted to accomplish with this project? And how did you do?
I wanted to be more active. I wanted to lose some weight. I didn't really lose as much weight as I wanted to, but I know I will lose more. I wanted to be able to sleep better because I knew I wasn't active enough. And it made me more conscious of what I wasn't doing, when I wasn't moving. And I'm much more conscious of my movements, and my activity levels are better. They're higher and only going to get better.
Oh no, I'm very happy. I'm very glad that we did this. I really am. For me, did I get what I wanted the first 90 days? Yeah, it created a certain awareness that I think which is very nice. Certainly I've learned a lot from these meetings. I really have, about all sorts of things, the diet part of it, everything else too. I think it's good for the patient because it does create awareness of things you need to do. I was dead set against doing anything like this because I did not want to be a slave to a device. Mm-hmm. And yet here I am, I got 5,800 steps. Man, if I get 200 more, I get 600. Now I'm the last person in the world that would do that. Now, am I doing myself a favor? I don't know. But if I walk 200 more steps, good for me. Better than the 5,800, I guess.
Where are you guys going to take it from here?
I'm going to continue on.
Yeah.
In the time that I've been doing it, it's become a habit to a degree. Again, I am going to resist being a slave to a device, but it creates a good awareness for going forward here for activity levels, and it is a very good idea, period.
Yeah, I totally agree. I would ditto that. Because you can come in and tell them one thing and, be doing something different. Here are the proofs in the pudding. And I think that they can, in our cases, maybe zero in on something that they can bring up when they see us face-to-face for appointments, or if we're having an ailment, or if we have, other issues that would help them. Yeah, I think it was beneficial.
This was a big motivator for most of the patients. They gave some examples of how their behavior changed because of knowing their provider would see what they were up to.
We're our own worst enemy. It's just trying to stay motivated and, keep your path in sight. And again, I think this is very motivational because your doctor gets a report So there's no hiding. You know, you might have a blood sugar reading that's, you know, really high one day because you cheated at night. And, well, I just won't tell him about that. Well, this way, you know, it's in the report. So, you know, he can say, you know, what caused that? You'd have to think back and say, oh, that was a birthday party I went to and I had 2 pieces of cake instead of none. You know.
Okay.
So it's a motivational, it's very motivational.
Knowing that something is always monitoring what I'm doing, you know, I mean, if a patient brings in donuts and I say, oh, today I can eat that donut, I'll remember that that's there and I hopefully won't eat that donut.
It just helps you, you know, stay on board, so to speak, you know, because there's someone there really looking beyond you. I mean, you do look for yourself, but there's someone also.
Yes, I'm very competitive. I see the numbers, and if I know I'm seeing the numbers, I know what I want to see, especially with the activity tracker. Super competitive about it. Actually helped me sleep better because I didn't want it to say I was awake, so it would make me lay still longer and I'd fall back to sleep. But knowing that I'm going to test my blood sugar in the morning and it's going to go to the doctor's office, it's like, okay, do I really need these M&Ms? Knowing what the number is going to look like in the morning. No, I don't. Put them back. Put the lid on. That I just seeing the information and having the information available and knowing that I'm going to be held accountable for it as opposed to I can just sneak it and nobody knows makes a big difference, I think.
Here's another important factor for home health monitoring to help patients make a change, brought up by Dr. McDowell.
I think it has to simplify things for patients. And that's maybe the tricky part is you don't want to just throw a ton of technology at patients and say, figure it out. It has to be about simplifying things for them. If technology can simplify things for them, then it's worth it. If it's going to make things more complicated, then maybe it wouldn't be worth it, you know? So that would be the tricky part is how to simplify this for patients with medical care. So it has to be done in a very smart way where it helps patients understand their disease, it helps them keep track of their disease, and that way they can be managed more safely and efficiently.
One patient we followed closely, Jim, told me about his progress in tracking an array of possible factors that might contribute to his issues with high blood pressure.
Do you remember what you wanted to accomplish in the project when you first started, and how did things turn out?
My original goal and what Dr. Weinstein got me involved with it was because of my blood pressure. He couldn't quite figure out why my blood pressure kept going up. So he said we try to do this project to kind of give me a monitoring system for me to go by to see if it's just when you come in here that you're having an issue. Is it me? You know, is it the checkup? And my last reading was 121/72. So, and then as a byproduct of the whole thing, getting the Withings watch, I didn't realize that it also tracks sleep. And then the steps that also tracks. So I was able to knock out another concern that I had, which was, do I have sleep apnea, which could have been causing the blood pressure? That's proven that it's not the case. So now I know I don't have sleep apnea. Strictly, I believe now the blood pressure was stress. So I'm learning how to deal things with stress-wise, trying to let things kind of go by the wayside. Before I make a phone call with work, I'll sit back for a few minutes, let it kind of go over in my brain what I want to say, and then I get on the phone, level-headed, and try to stay calm. So those are all kind of byproducts of wanting to get my blood pressure down, which the numbers speak for themselves right now.
There are going to be practices looking at this type of thing, and with some skepticism, as we all had at the beginning.
Right.
What would you want them to hear from a patient's perspective?
I'm kind of I thought it would be a thing that a baby boomers like me, I'm 1964, so 45 to 64, we're all getting older now, we're all retiring. Are we going to embrace this type of online medical, or do we still want to come in and see our doctor? But having talked with a lot of people, showing them the equipment, I mean, I'm wearing a watch for business, and telling them what it does, they're all starting to buy the equipment. They're all saying, geez, I'd like to have that to be able to show my doctor that this has been my blood pressure since the last time I saw you, by week, by month, whatever you want to look at it. If you have that as an option, to your patients, I think you'll find more people open to it. And it's step by step online. You follow the steps with your phone, and pretty much everyone has a phone now that's capable of doing it. Somebody in their 70s or 80s may be a little bit reluctant, but if they have a son or a daughter or somebody that can show them how simple it is, or have them bring the phones into the office and have people who can just set it up right there for them, it's not that long, it takes that long to do, and they could walk out knowing that they put it on, they press a button, it takes their blood pressure. I mean, when it's all set up, that's all it takes, and it's real simple, and that's why I like it. And then being able to have that when I travel all over the country, I have this in my pocket. If there's a problem, I can walk into a hospital, pull up my healow account, and I can show them everything they need to see in the emergency room if it's an emergency, or if I'm not feeling well, these are the medications, this is what I'm allergic to, this has been my blood pressure history for the last 120 days, or how far back they want to go. That makes me feel more comfortable when I travel, makes my wife feel more comfortable. So I think it's a great option if somebody wants to show to all ages of the people that they're taking care of that this is what we have. If I owned a practice and how I can appeal to more people to come to my practice to take me on as a doctor, I would definitely want this offered.
That's lesson 3. Keep it simple. Jim had a lot of factors that could be contributing to his blood pressure, and by putting it all on one screen, it made it easier for him and his doctor to figure it out together. Here's Dr. McDowell again.
Medicine is complicated. A lot of, for example, the elderly patients who do well usually is because they have a healthcare proxy, a family member, a caregiver who helps them organize their medications and reminds them to eat healthy. It is a lot of work, and it's a lot of information that we're giving our patients, and it's very difficult for them to remember everything and track everything, and some people just can't do that. So that's where I see technology, if they can make it easy for the patient to keep track of these things, then it could definitely be beneficial to them.
By making it easier to monitor their conditions, we had a surprising outcome that Jessica told me about when we sat down to talk.
I really didn't reach a lot of my goals, but it actually did something else for me. Instead, I did lose weight. I've actually lost 24 pounds. I was actually skeptical myself in the beginning, just even from a security standpoint. I'm like, I'm going to be throwing this stuff out on apps, and I haven't had a problem with it. I liked being able to say, this is how I'm feeling, and my doctor being able to say, okay, let me, you've been checking your blood sugar, as opposed to me having to sit there and type it all in and do all of this and send it, and that she had the ability to just look at it and say, this is really high. What did you eat? Did you have a lot of carbs? Did you have sugars? No. That it just made the interactions a lot easier. And because it was going to be easier, it made me not quite as hesitant. She was able to see my blood pressures and see that those were running okay. So if I'm lightheaded, it's not because my blood pressure was too low that day or too high or whatever. It just made everything a lot easier. So I would encourage it. Like I said, I was really skeptical, and my husband was in the beginning too, but it turned out that we were really happy with it.
By being able to make changes in the way she took care of herself, Jessica was able to see that there was something else going on. She was monitoring blood pressure, blood sugar, sleep, and activity. Since she already had these known health issues, she was blaming some of her symptoms on those things. But by making improvements and seeing her levels all in one place, she and her provider were able to see there was something else missing, and it led them to run more tests for a diagnosis and further treatment. And this was because she was able to see the direct correlation between her choices and her health metrics. Equipping patients with this information can lead them to make changes. In our initial interview 3 months ago, you'll recall that I asked all the patients to reflect on what would happen if they did not make a change. Marianne responded that this was not an option for her. She had to make a change. Here's her update.
Stopped my walking program again, and I succeeded. I do 3 to 4 miles 4 days a week. And that's constant walking. I go to a certain point, turn around by my house, and I come back. So it's 3.5, it was 3 miles I started, and this week I pushed it up to 4. So I definitely accomplished that, and that was my key thing.
Now that the project was coming to a conclusion, I asked the patients at Grove Medical to speculate on the future once more.
Oh my God, no, I'm definitely gonna use them. Definitely gonna keep using them.
Because it's become a habit.
No, I'm gonna keep using them. Big fan. Yeah. Big fan. I like them all.
I'm gonna maintain. Just keep doing what I'm doing. You know, I hope we do meet again in November. You know, I mean, I really think that this is more habit now.
I'm so happy that I was chosen for this, to be honest. Changed me and made me get up and start.
We set out to tell the story of a practice that wanted to go beyond caring for patients during office visits, to keep caring for them using data obtained through home health monitoring, and the story of the patients who were trying to improve their health. Most of the people involved in this project, myself included, were surprised by just how much of an impact this had on the patients. We learned a lot from this experience too.
He's always been somebody who's worked with me because I did not want to take medicine. I thought taking medicine meant that I was getting old, and I could always do things with a change of lifestyles.
The main goal of most physicians, I think, and I hope, is to have healthier patients who live longer, healthier, with fewer complications. It really helps engage the patient, helps you understand that patient and what their life is like, and makes you a better physician, which is ultimately the goal, is to be the best physician you can be.
My mother, my father, to monitor themselves at home and share that information either by telephone or digitally, and then get information back right away. I'm convinced we'll do a better job of managing these chronic conditions.
People care. It's like they care about you. They're not just another number. You're their patient, you're their friend. They want to see you succeed. And that's what a lot of doctors should do.
Patients are curious about tracking devices and want to start using them, but they still need communication and guidance from their providers to understand what the data mean to them. It can encourage patients to know they can discuss their progress with their provider and with other patients, but the technology has to simplify things to be useful. When you give patients tools to help them monitor their health, when you make it part of an ongoing conversation with their care providers, and when you just make it easy for them, it can make a difference. It's the future of healthcare, and it's what a doctor should do. I'd like to take a moment to give thanks to all the patients who are willing to tell their personal stories, the staff at Grove Medical, especially Gail, Dr. Weinstock, Elise, Ray, and Michaela, iHealth and Withings for sharing their devices to make home health monitoring possible for the project, everyone at ECW and healow who helped with this, especially Melissa Alexander, Bhakti Shah, Dr. Hinson, Mike Weber, Nicole Mazzulli, Daniel Chaplin, Charles Diaz, Kayla Cowett, Adam Salati, Eric Oglesby, and thanks to you for listening.